Hello everyone, welcome back to Fabio, a knowledge-based online platform made for all urological queries. Today's episode is specifically related to a urological procedure known as hydrocele treatment. A hydrocele, in layman terms, is a fluid collection around the testicles, but if it's small and doesn't cause significant concerns, the urologists don't recommend any treatments. The other way to drain the fluid is by aspiration using a needle, but that's a temporary solution. It, however, tends to return soon and also comes with the risk of infections. Now, if your condition requires action, you might have to undergo hydrocele surgery. But be prepared to feel a bit bulkier in your testicles than before post-surgery. So what's this procedure all about? It's basically the removal or repair of the fluid sac surrounding your testicles to prevent further fluid accumulation. On the day of your procedure, your urologist and their team will review your history and medications, go over the surgery details, and secure your consent for the treatment. At this stage, an anesthetist will discuss with you the kinds of anesthesia that could be administered to you during the treatment. They also plan ahead for the pain relief procedure to be followed after the operation. The hydrocele surgery itself usually involves a general or spinal anesthetic. A small incision will be made into your scrotum to drain the accumulated fluid. After the fluid has been drained, the surgeons either seal the sac with absorbable stitches or remove it entirely in some cases. This is all to prevent the fluid from recollecting. Once the procedure is completed, the skin is closed using dissolvable stitches and you are provided with a scrotal support. There are certainly some risks of after effects involved. Almost all the patients experience a swelling and discomfort in the scrotum over several days. A more pressing matter is the risk of infection. This can ask for another round of antibiotic intake or even surgical draining. In some cases, the hydrocele might reoccur or you may experience chronic pain in your scrotum. However, these conditions and the specific treatment's odds depend on individual health conditions. Once home, take considerable care of your health. There might be swelling and bruising of the scrotum, and so a scrotal support is usually advised to make the post-operative phase more comfortable. Also, avoid any strenuous exercise or heavy lifting for at least 4 weeks after the procedure. Some painkillers for discomfort and ice packs to curb swelling can be helpful too. Once you have been discharged, your GP and your surgical team will always be on hand to review your overall health and to answer any queries you may have. Before signing off, let me re-emphasize that anyone decided for hydrocele surgery should quit smoking prior to it. This is because smoking could amplify the post-surgery issues. Drive safe and make sure you are fit to continue normal activities with due consent from your surgeon.